Okay, so let's take a look at some of the anatomical terms that we're going to have to be remembering here. One of the things we have to remember is that we have to use the correct terms because we may be using words that we think are correct, but in actuality, nobody understands what we're actually talking about because the words that we're using aren't necessarily the correct terms as they actually are supposed to be meant to be used. Why do we need to have the anatomical terms? Why do we need to be able to communicate correctly? Well, what it's going to do is it's going to ensure that everybody knows where we are talking about. It provides a location. It provides a location relative to other locations. It allows us to divide the body into distinct planes and distinct areas. It allows us to explain patterns of movements. It allows us to explain orientations of the body or parts of the body relative to other parts of the body in the three-dimensional, or actually four-dimensional space that we live in. It allows us to ensure that all of our colleagues know exactly where we are working and how that thing happens to be functioning. Without this correct terminology, mistakes can have horrible consequences. This concept of mistakes having horrible consequences takes us to a very real concept that we have to remember when we're dealing with terminology, and that is the concept of anatomical mirroring. Anatomical mirroring is the indication that when we're facing a patient, that is when we're face-to-face or ventral side to ventral side, what is my right is not the patient's right. Everything is flipped. This is very important. One of the times that I was working with the people at the Colonel and Job Clinic, I was observing a hip surgery. And remember Dr. Job coming in and noticing that the surgical hip was incorrectly marked. And he looked around the room and he's all, what is this, backwards day? If he hadn't caught that mistake, think about what would have happened for the patient. When we're dealing with this anatomical mirroring, what we have to remember is that what I'm thinking of as my right side is the patient's left side. One of the ways you can start to practice this mirroring issue is using the bathroom mirror or using a hallway mirror. And try to point to what you perceive to be your reflection's right side with your right hand. If you reach straight across, you're not reaching to the person's right, you're reaching to the person's left. You actually have to go across the midline of the body in order to get to the right side using your right hand. That is what we're talking about when we're talking about anatomical mirroring. The other way of thinking about it is when someone says, oh, it's on your right, you might ask them, my right or your right. That is the same concept that we're talking about here.